Welcome to Chat with the Docs, your place on the interweb where you get to pick the brains of us.
Yeah. So today we'll talk about more the lower part of the body.
Today, we get to talk about plantar fasciitis, also known as the pathology that does not follow any spelling rules whatsoever, so forget about trying to learn how to spell it.
Lots of eyes.
Woo! It's like something out of the book of Daniel. Anyway, welcome. We've made it through another week without any cease and desist letters. Yeah. This we'd like to just full disclosure, right? This is YouTube. You're supposed to say full disclosure, and everyone says, "Ooh, they're
Fancy.
journalistic." Full disclosure. This episode of we are Chat with the Docs. I'm not sure. I'm not quite myself today. This episode of Chat with the Docs is brought to you by the fibula. The funny little bone with a funny little name that has a great influence on that funny pathology that doesn't follow any spelling rules.
Yes, it does.
How was that for a segue?
Perfect.
Wasn't that cool?
That was very cool.
And we don't even have writers, guys. Wow.
So
Bob Hope, eat your heart out.
I've had plantar fasciitis in the past. Have you?
I have. It was horrible. It was horrible.
It's pretty common.
It made me understand why a coyote will sometimes chew its leg off.
It can be pretty bad.
When you're on your feet all day working,
Mm-hmm.
and our clinic we're on the second level of the building, but we've got 14 inches of concrete between
tile,
the buildings.
Concrete.
You have tile on top of concrete. You're slopping your feet around all day on concrete. It's miserable with plantar fasciitis, and it just gets worse and worse.
Yep. Mine had started. I was wearing like booties. So right where, and not baby booties.
I would never be
that
caught
young.
dead in booties.
Short little boots, not the full size cowboy boots, but right where that heel hit was about right there, and that was throwing me off. And it was also kind of messing with the arch on my right foot, and it still isn't fully there, but it's getting better.
Define plantar fasciitis.
So plantar fasciitis
Say it right.
Fasciitis.
Yes.
So you have the plantar fascia that hooks on the plantar surface or the bottom of the foot. It hooks back in by the heel or the calcaneus for technical terms, and then it feeds into where the metatarsals, the tarsals all are. It goes through that whole surface. So when it gets irritated, you get micro trauma on it, inflamed, usually from lack of proper footwear.
Yeah.
It will start hurting.
I do have patients that will have this situation from a Lyme infection and a Bartonella infection, and they get these tiny little cysts all through the fascia, and now you're walking on little gravelly things all day long, and
they almost feel like little marbles or little pea, like,
and they can move around.
Crazy.
Why do you say crazy and look at me? Why does everyone say crazy and then look at me kind of like hey, look at the chimp in the zoo? My self-esteem is low today. Can't you tell?
We need our hats.
We do need our hats. Too bad we sent those to the recycling bin.
But that's what plantar fasciitis is. A lot of times people will start to notice it. Your feet will be maybe aching, for a few days. You get up first thing in the morning, you take that first step, and it just burns on the bottom of your foot.
And that's just it. It's usually worse in the morning.
Mm-hmm.
And so then you go to your doc and they have you buy these goofy little boots that, put your foot in traction all night long.
That doesn't work well for me. I've tried that already. It's uncomfortable.
It's so claustrophobic.
I think I have too big of calves for that. It cuts it off at the end of the night. But you don't only have to do that. That's not the only choice you have for something like this.
Well, and then the other standby is, you Google it. But number one, WebMD or Dr. Google, whatever it is, says that over 3 million people a year get treated for plantar fasciitis.
It's very common.
It's probably more than that because I see a ton of it.
Mm-hmm.
In my acupuncture practice, there's at least 1 or 2 people a day getting treated for plantar fasciitis.
And sometimes it's not even that the plantar fasciitis is acting up necessarily right away, but it's the lack of the proper arch of the foot.
Yeah.
And then you're getting back pain and it's just traveling up
Well-
the spine. You're getting other things.
Well, you can be starting with somebody with back pain, chronic back pain. And as you fix the back pain, then suddenly the knees are starting to hurt. Then the ankles and the plantar fasciitis comes out.
Yeah.
I'm going to do that the whole show just to irritate you.
If you start if you start getting like a lisp or something like that as you keep going on, maybe you should stop. But
Plantar fasciitis. But the problem is a structural problem, and when you throw structure off up above and it's chronically off, now the body adjusts for it, and then you start fixing the problem above, and now the body has to readjust.
Yeah.
And that can cause it.
Yeah.
You can be getting your back treated, your knee pain treated, and suddenly, as that gets better, you got pain in the bottom of your foot. Well, you just go after it and treat it. That's the bottom line.
The body's been compensating this whole time.
And
you're waking it up now because other things are shifting, as you said.
Typical treatment would be immobilization at night and stretching a little bit on it at night with those boots. The boot is designed to put a nice stretch. I'm plantar fasciitis. That's why I'm not an orthopedic surgeon.
When you sleep, your feet are mostly straight like this. Well, then this can shorten.
That contracts. And if there's any inflammation in there, when this contracts, it then gets inflamed. So those traction boots pull all of this stuff back to put a nice light stretch across the fascia. So that way it doesn't have the chance to contract.
Up overnight. Because when it straightens like this and you take that first step in the morning, it's stretching out. You're feeling all those little micro tears and inflammation.
And it's miserable. So they'll give you the boot.
Mm-hmm.
I have relatives that have tried to give me the boot for years, but I keep coming back.
Your brother?
Well, actually, yes. Actually, I was. They tried to vote me out of the family 3 times.
Yeah.
It was only because of a filibuster that I survived. Anyway, democracy in action, right? They'll do the boot. Then one of the other things they like to say is rest, ice, and elevation.
Yep.
Not necessarily that good for plantar fascia. The fascia is it vascular or non-vascular?
It's non-vascular.
It's non-vascular.
That's why it doesn't work with the Rice method of.
That's right. Did you catch that? It wasn't just Mo saying it. It was the chiropractor saying it doesn't work with the plantar fasciitis.
It's different.
It's different. You go back to the American Journal of Sports Medicine. It drives me nuts every time someone comes in with a labral issue in their shoulder, and their PT, their chiro, their MD says, "Well, just put ice on that." They've been icing it, and nope, it's never gotten any better. The American Journal of Sports Medicine, starting in 1994, I think it was, and at least a dozen times thereafter, has published articles saying, no, don't ice a non-vascular tissue injury. Mm-hmm. What's non-vascular tissue? Well, bones. I'm not trying to slap you. I'm trying to pat. Remember, it's brought to you today by the fibula. Bone tissue is can be considered non-vascular, certain parts of it, although the periosteum's got a lot of blood flow through there. The marrow's got a lot of blood flow through there.
Usually you're looking at the connections to the bone.
But it's the connections to the bone. Yep. It's the cartilage,
yep.
It's the tendons, it's the ligaments. These things are the non-vascular. And when there's tears, when there's inflammation there, nerve tissue is non-vascular, by the way. These tissues don't respond well. In fact, they can be damaged with cold. And so getting the old frozen golf ball out and cranking your foot across it is only going You're going to bruise your foot and get it really cold.
You do got to work that tissue up though a little bit to get it going. That's why it feels better when you start walking.
Yes, you do need to work the tissue, but don't do it with an ice cold golf ball.
I've never heard of the ice cold golf ball.
Oh yeah, you hear all kinds of stuff.
Water bottle, the cold water bottle I have, just to get through it sometimes.
Yeah.
But yeah, so I guess when I see it, it's usually because improper footwear, like I did, or you start to have it where you're chronically wearing improper footwear and you start to lose the arch and it starts to drop, and then you get a different tension, calf tightness, because you're always wearing because if you're always wearing heels and you're changing the angle of the foot, calf is going to tighten up. Then you go to sleep and it's just getting shorter, stepping down, plantar fasciitis there.
Poor little doggies.
But those are where I usually see it.
Yeah. The patients that come in with plantar fasciitis, it's usually from those same things. Mm-hmm. But occasionally you will see somebody coming in with chronic pain up above.
Yeah.
That starts getting better, and then the plantar fasciitis kicks in.
Yeah.
We are not talking about Morton's neuroma.
No, that's a different thing.
Morton's neuroma is a total other ballgame.
More through here, can be here.
And that's nerve inflammation.
Mm-hmm.
Morton's neuroma.
That's not going to get better as you walk, though. That's going to get worse as you walk.
It's going to get worse. Morton's neuroma is a totally different game.
Yeah, plantar fasciitis, it has like 3 spots that you're normally feeling that pain. It's usually just under the heel. Sometimes you'll get actually a heel spur where the calcaneus will extend.
Well, where else would you wear your spurs?
Yeah, I guess so. On the heel.
I'm sorry.
This is on the other side of the heel, though, not this side of the heel. If there's so much tension because of Wolf's Law, maybe your law, I don't know.
Probably a relative.
Are you going to claim that one?
No.
If you have pressure on something or continued tension, the bone will change to meet its environmental needs with that. So if you have constantly...
Can you say that again?
Environmental needs.
No, the whole thing.
No.
The changing of the... Can you recite Wolf's Law for us? Because it's important. You need to hear this. I don't want you to miss it.
I thought you were making fun of me.
No. I'll save that for later.
Okay.
Are you kidding? The program's still young. We've got 45 more minutes to go.
Good 40 minutes for shots.
Well, somebody just hung up, so they were waiting for me to make fun of you. We went from 4 to 3.
Anyways, Wolf's Law is if you have a constant force, a tension on a bone, it's going to change to conform to its environment, whether it's...
So you mean a bone can change?
Yes.
Oh, you can change bone structure.
Just like the ones you study, if you're looking down all the time, your neck will actually reverse the curve because you're doing this all the time. It's conforming to the environment. If you're having a constantly tight bottom of your foot, that plantar fascia, you're going to get a bone spur. Yep. Text neck. It changes us.
Yes.
We're actually starting to see like little horns growing at the back of the occiput because of this, because it's anchoring us back and it's pulling on that bone. So it's real. Just like arthritis. That's Wolf's Law. It's trying to stabilize. Mm-hmm. You see that in the spine. You notice it more in the fingers because they don't have as much, fatty tissue over them. But it's also on the bottom of the foot. You usually don't realize it, though, until you get an x-ray because it is deeper in the muscles in that. So things I like to do to help with plantar fasciitis, I adjust the foot. Usually the tarsals are dropped a little bit. You try to get it that we're having proper arch to the foot instead of dipping in all the time.
When a tarsal is dropped, does that mean it has a low self-esteem?
The person does.
And you have to say, come on, little tarsal, you're not so bad.
Usually I'll have the patient like laying face down so their foot is up like that. And either I'll have a little activator or I'll drop it in like that.
By the way, am I the only one that finds it a little creepy that she shows up with body parts? Several episodes ago, she ripped the spine out of somebody and part of the lower skull and brought it in to show you nerve roots. Today, she walks in with an entire, the whole sub-assembly below the knee.
I was hungry. It was good until we got about here. That
Then
was
it's just-
tough.
Well, at least we
I
now
live
have a
from up-
test subject for prion disease.
I live up north. We don't know any better.
Hey, is somebody calling in?
That'd be pretty cool.
That would be wild. We should probably have Carrie man the phones for that and
That'd be cool.
put the phone line out there.
But I will adjust the tarsal so you can do it that way. You can do it with an activator. I have also worked with taping to try to get the correct posture with the foot.
And that's really interesting. You know, you look at KT tape and you wouldn't think that it does anything. It's just this stretchy, gauzy type
I love this stuff.
tape.
Absolutely love it.
Yes. But what's it designed to do? It's designed to stabilize the fascia.
And allow movement at the same time.
At
which
the
is why
same
it's
time.
so cool.
So if you've got something that's going to stabilize fascia and you've got a fascia injury,
Boom.
brother George, it's phenomenal.
It is. So I like to work with that because sometimes it's not just on the bottom of the foot. You know, you go up higher, like you said, fibula, calf, all that's
You will
intertwined.
notice when you're doing the palpatory exam,
It's tender.
you can actually feel a pattern of collagen adhesions in the gastroc all the way up.
Yep, follows that Achilles and it goes deep.
And if you follow the pattern that's laid down, that pattern repeats itself between every joint of the body, clear up into the back.
Yep.
And so,
That whole posterior chain.
yes, and the longer it goes, the higher up these collagen adhesions, these little nodules, go in the body. And so one of the nice things that I'll do, can I borrow your leg? I'm pulling your leg. Anyway, one of the things that I will do is I will find those little guys and I will push my thumb on it and I'll kind of let that thumb comb through the tissue while I'm moving the ankle.
Perfect. And that's how you can tell too if the fibula is moving, is going like that. It should have some give that you feel it move. If not, usually there's a restriction up through there as well.
And that will break up those little collagen adhesions. Why does the body lay collagen down in these little nodules? It's because it's stabilizing. It's trying to create mechanical advantage. You're dealing with a pulley system.
Our body's always trying to help us. It just doesn't always show up like we think it does. That's pretty much somewhat with symptoms that it shows. It's trying to tell us what's wrong. It's trying to help us.
Yeah.
So besides KT tape,
this is cool.
These are pretty cool. So I learned back when I first started working right outside of school. I did not learn this in school. I learned it with additional, training from my mentor. You can help your patients a little bit more by adding orthotics that they can stand on. I'm getting all hooked up today with the foot. So this is just the baseline. This is how your foot should be. You should have some arch on the inside, or the medial arch should come up.
For St. Louis, you should have a really big arch.
A lot of people dip in. You add that in, and it helps to correct it. Not everybody is perfect and has, takes it well with having that much arch put in, though. So sometimes we have to mold it that it's a little bit lower, and then we gradually build you up. Some people have a really high arch.
You build me up so my arches are not falling.
Some people have a really high arch, and they'll even drop even more because there's not a lot of shoes that have support for higher arches. Ugh.
Well, that's why you have to go to a gifted and talented arches.
We can help with that too. You just have to add more arch support in. I've had a few people come in that they're always having foot pain. You give them the right support through the orthotics. That takes care of itself. And then sometimes you will notice better holding with the low back and everything else.
Did you notice what she said? She doesn't just go in there and crank up the arch. She starts out mild and gradually builds up. Sometimes when I'm doing a structural assessment on somebody, I'll see how one shoulder's dropped and one hip's up, and you get down and you look at the arches, and one arch is low, and then you just take the slightest little bit, maybe maybe a 1/16 of an inch of a
Yep.
wedge, and you put in there, and you go back up and you see how it's affected. The hip is no longer not nearly as much out. The shoulder's up a little bit. It's incredible how systemic something so minor as adjusting the foot,
Yep.
the bed on which the foot is sitting, how that can affect everything else.
Oh, definitely. Because I know my right foot is dropped. Those tarsals are dropped. My left low back has a little bit different bone structures with the joints. One is horizontal, one is vertical, just with, how those go. So the body conforms, so everything balances out more.
Mm-hmm.
And I'm pretty sure that's where it all started with that. But so yeah, those are options with plantar fasciitis with that. We're going to work on, just like Mo said, with breaking up those adhesions through there, because that's a big part of it. You can't just let it be and let it stay tight. You have to work through it.
Yes, it's something that over time, yes, you will get some of those knots out.
Mm-hmm.
They'll just metabolize and go away, but most likely not. Did you get that?
I got that.
Oh, Mark, I need sleep.
We all do.
Wow.
Summer's getting us. We're getting to the tail end here. We've been partying too hard.
I get up early in the morning, and this morning it was a little depressing how dark it was outside at that time.
Yeah, it's changing. Even at night, it's getting darker sooner.
I don't like that. Hero, are you hearing us, boy? Are you out there, laddie? By the way, Hero, we're probably going to need you to just edit the first little bit of the video, because I had to go and take care of somebody, and so that's why we started late. But that has absolutely nothing to do with the show, other than I'm just communicating with our engineer guy.
Also, no, you're good. Do you work with the Achilles tendon as well when you start working with plantar fasciitis?
Usually have to.
It's got a lot of neurology in it.
Always goes up the body. The other thing is with that Achilles tendon, and this has nothing to do with plantar fasciitis, but with the Achilles tendon, actually, I don't need your orthotic. The Achilles tendon, comes up through here. But when I'm dealing with somebody that's got a severe occipital pain, a C1 issue, one of the places I'll go, you mentioned that Achilles tendon is so tied in neurologically.
Mm-hmm.
I can put needles right in that little area there on the Achilles, right where it attaches. 3 right there, boom, 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 real close together. And that releases all of this area up here.
That's super cool.
It is. But what else does that tell us? If you have plantar fasciitis down here and it's spreading up into the Achilles, it's affecting everything.
Mm-hmm.
Because if you can treat systemically, you can also pathologically affect everything systemically. So if you're starting in with plantar fasciitis, it's not something you can just say, it'll go away. It's only affecting no, it's affecting everything.
I have a patient.
I'll
now that you bring that up,
I present you your leg.
Because I always love picking your brain and like hearing, because
that hurts too when she picks your brain.
We had similar training, but it was different, and there's just different things that I've learned from you with that.